Welcome to Raaonline. Today's topic is Neuraxial Analgesia for labor. So, as it is noted by the American Association of Anesthetists and American Society for Anesthesia and American College of Obstetrics and Gynaecology, there is no other circumstance where it is considered acceptable for a person to experience severe pain amenable to safe intervention while under a physician's care. And in the absence of medical contraindication, maternal request is a sufficient medical indication for pain relief during labor. So we should not allow women to suffer during labor pains. So why labor analgesia? Labor pain is one of the most intense pain that a woman can experience. Pain, stress and anxiety increase the cortisol and catecholamines that affect uterine activity and uteroplacental blood flow. Adrenaline has got tocolytic actions and severe pain can lead to adrenaline release, and this may lead to an uncoordinated uterine contractions and she may not have a normal labor. So pain during the first stages of labor, in the first stage of labor, which is from the start of labor or the onset of uterine contractions till the full cervical dilatation and effacement, that is 10 centimeter, the pain fibers are mainly visceral. So these are the slow visceral C fibers, and the pain is usually dull, aching and poorly localized, and these fibers from the uterus enter the cord at T10 to L2 level, and they are also mediated by bradykinin, prostaglandin, serotonin and substance P are the mediators for the transmission of this pain fibers. Now in the first stage of labor, we should understand what should we use, and in the second stage of labor, we should understand what we should use when it comes to pain-free labor. So when it comes to pain relief in labor guidelines given by NHS, women should make fully informed decisions regarding pain relief in labor, and ideally women should discuss pain relief in the antenatal period with the midwife, and if inappropriate, a birth plan written to support the woman's choices in labor can be given earlier. Now when the women enter in the first stage of labor has two phases, the latent phase and the active phase. The latent phase is when the cervical dilatation is less than 4 centimeter and the uterus contractions has started. Now this is also a slow phase, and in this phase or the early slow phase, first stage of labor, the patient has high anxiety. So there is a high maternal and family anxiety, and this has no finite length of time. Most women are asked to stay at home or return to home and use simple analgesia, TENS and water and mobility. But in some places, we do admit them even in the latent phase of labor. And in the latent phase of labor, they say 1:1 care is not needed and patient can go home and come back when she is in active phase of labor. But whenever the lady is unable to stay at home, or she is alone home, or she requests this, or she medically need to be in patient in antenatal ward, then we should give them the latent phase bundle of care. Now what is latent phase bundle of care? That means we should give them non-pharmacological methods of pain relief. We should give them psychological care and emotional support with the help of midwife, and at times simple analgesia and opiates. So low strength can be given by midwives and high strength can be given by doctors. So the low strength includes cocodamol, and cocodamol is 8 milligrams of codeine and 500 milligrams of paracetamol that can be given by midwives in the latent phase of labor every 4 to 6 hourly, and high strength cocodamol, which includes 30 milligrams of codeine and 500 milligram of paracetamol, can be given by medics in the latent phase of labor. Now in the active stage of labor, when it is 3 to 4 centimeter of cervix has dilated, various methods have been proposed like hypnobirthing, acupuncture, water bath, transcutaneous electrical nerve stimulation and epidural or neuraxial analgesias. Antonox can be given, which is equal mixture of oxygen and nitric oxide. Opioids have been used, and remifentanil infusion is very popular these days in the West. Now what is hypnobirthing or TENS? It is a relaxation, and it is just a surge and birth breathing techniques, and TENS has also been tried. And then there is also birthing ball or exercise ball or water bath techniques to reduce the pain in the active stage of labor. And now coming to Antonox, Antonox is a 50-50 mixture of oxygen and nitrous oxide. TENS is not that effective, and opioids just mimic the endorphins of our human body, which are physiologically present, and they depress the neurons carrying impulses, pain impulses. They depress the neurons that carry pain impulses to the brain. Coming to neuroaxial analgesia for labor, the contemporary analgesia for labor includes classical epidural, spinal, combined spinal and epidural, and dural puncture epidural analgesias. Now, what are the contraindications to neuroaxial analgesia if the patient is refusing, if there is an unavailability of equipment and resuscitation, allergy to local anesthetics, local skin infections, also we cannot put the needle at the site, coagulopathies, and low molecular weight heparin within 12 hours, if there is an increased intracranial tension, maternal hypotension, or maternal sepsis or bacteremia, we cannot give the neuroaxial analgesia to the mother in labor.